In tonight's Healthier Me, more than 5 million people head to their doctor each year complaining about dizziness. Now a group of experts is updating recommendations on how to diagnose and treat vertigo. Meg Oliver has our story.
I'm going to have you cross your arms.
A bump on the head from a kitchen cabinet sent Jacqueline Irizarry into a tailspin.
Sort of like if you're on a boat and the boat is going from side to side.
1, 2.
She's suffering from benign paroxysmal positional vertigo, where tiny crystals in the inner ear become dislodged, causing a person to feel like they're spinning or the room feels like it's spinning.
Sometimes I do feel a knot in my stomach, nausea.
Now, the American Academy of Otolaryngology has new guidelines to help diagnose and treat this very common problem.
This is a diagnosis that can be made by history. The patient will give you the history if you ask the right questions. You should not do X-rays or CAT scans or MRIs on these patients, even though they're very afraid.
Ear, nose, and throat specialist Dr. Sujana Chandrasekhar says doctors should also not prescribe motion sickness drugs like meclizine or Dramamine for patients because they're unnecessary.
Vertigo can be disabling, but doctors say once patients get the right diagnosis, almost all cases can be treated and resolved.
I'm just going to shake your head like this.
Dr. Chandrasekhar does a few proven maneuvers on Jacqueline.
To take the stones away from the active portion of the inner ear, put them in an inactive portion of the inner ear, and let them sit there.
I'm hoping to not have that feeling. I'm hoping to be able to function.
And the treatment worked for Jacqueline. She's back to her normal activities.
Doctors also say some patients may need repeated treatments to relieve their vertigo, so vestibular rehabilitation therapy may be helpful. It's winter go home as NDSU and SDSU meet on the diamond. Highlights later in sports. Up next, before you grill this weekend, we have a recall on some pre-cooked sausage.